majority of you in this class are going to be wanting to get into some sort of a clinical, area, whether it's nursing school, PT programs, PA programs, whatever. So as you are trying to determine best ways to set up, clean up in a medical setting, whether it's the hospital, whether it's, private practice, whether it's, whatever. You have to take into account what microbes are going to be there, have to take into account what chemicals and compounds you have at your disposal. And then finally, you have to also take into account that, what is the process? What is the methodology? What are the, the pros, the cons of each of the different types of chemicals or compounds that you can use to sterilize, decontaminate, the environment. So when you look at these processes, is it a spray? Is it something you wipe down? Is it something you apply? Is it a piece of equipment that gets put into a sterilizing unit? Can you use heat? Is the equipment or machine you have to clean, sterilize, whatever, can it be damaged by liquids? So that means you have to come up with some other mechanism, some other way. We find that the chemicals, the compounds that we can use, fall into two categories. First category, bactericidals. Second category, bacteriostatic. Cidal, killing. Think homicide, human killing. Bactericidal are compounds, chemicals that will kill the bacteria present. Bacteriostatic don't kill, they interfere with metabolism to the point that it just slows down metabolic functions, slows down the growth of the microbes. Previous chapter, remember we talked binary fission. One bacteria within 20-30 minutes splits, becomes 2. 20-30 minutes later, those 2 become 4, and so on. Bacteriostatic, slow down the metabolism to the point that, now instead of measured in minutes, it's measured in hours. Is this going to kill the bacteria present? No. But it's going to slow down their processes. It's going to gum up the works. Yes, some will die, but not all of them. And when we talk antibiotics, we're going to see that the bacteriostatic ones will slow down the growth to the point that it allows immune systems to catch up. Everything that we would use for sterilizing, for disinfection, decontamination, are inappropriate for use on and in animal tissues. So we've come up with this other idea of things being antiseptic. Sepsis is having an infection in the blood or the tissues, the presence of microbes in the blood or in the tissues on the surface. So asepsis, the lack of, antisepsis, is the treatment to remove. We have to keep this in mind that you can't put a person into a sterilizing unit. You can't use the different, glutaraldehydes. You can't use ethylene gas and all these other things that we could use in a medical setting to clean, disinfect, or sterilize a surgical wing. Those do not apply to us humans. One of the things that in the medical setting that they have to take into account is what level of clean is actually required. Now, we would love it. You go to the hospital and everything's sterile. The chairs, the tables, the beds, the equipment they hook you up to, everything sterile. but we know that it won't work. Okay, so we've come up with plans. All the hospitals have their own cleanliness plans, means of keeping the environment at appropriate levels of clean for their patients. Things that are going to be inserted or things that are going to come into contact with the internal tissues of a human, sterile. Scalpels, the probes, things in the surgical wing, sterile. Things that don't have to be sterile, the gurney, the chairs, the electronic monitors do not have to be sterile. These can be decontaminated. All the vegetative cells, or most of the vegetative cells, have been destroyed. Endospores, not so much. Why do we go with decontamination versus sterilization? Well, size of whatever it is. You can't sterilize a complete gurney. Many of the monitors and electrical equipment that we now find in surgical wings don't handle heat well, don't handle liquids well. So you have to come up with means of just at least cleaning the outside, removing most of the microbes present. So, which method would you use? Well, depends on what it is. How it's going to be, in contact with the patient. Is it, if it's a surgical wing, the electrodes that will be placed on the patient, sterile. The lines coming from the electrocardiogram machine, decontaminated. The EKG machine itself, decontaminated. What it is, how it's going to be interacting with the patient, will the patient be touching it, will it be touching the insides of the patient, will determine what levels of quote-unquote clean are required.